Hello, I'm Dr. Vanderstelt, board certified orthodontist and owner of Aligned.Orthodontics. I want to chat a little bit about the connection between the jaw structure, airway, and teeth and how it's all connected. So if you're watching this, then you probably signed up for one of my complex consults. These are different than a complimentary consult because we dive deeper into the interconnection of the jaw structure and the teeth and the airway and the bite. So I want to give you some background information before you come in, just so that you're a little bit more prepared. I want to help you understand really how TMJ problems, grinding, and your bite being off can actually be a bigger root cause issue than just the position of your teeth. I think it's important to understand this because we might be talking about some difficult things, and I'd like to wrap your mind around a little bit more of the connection. So first and foremost, to have a healthy bite where your teeth come together, that starts with the foundation, which is how the jaws grow. Now, the jaws can grow in many different directions incorrectly, but typically we're looking at the width of the jaw and how far forward the jaws grow, and then how the jaws grew in relation to each other, as well as the head. The jaws are literally the foundation of how the teeth are going to come in, as well as the foundation of your airway, the nasal passageway and the airway behind your soft palate and your throat. So there can be some airway implications if the jaws don't grow correctly. So basically, if your upper jaw is narrow, we're looking at how is the quality of your nasal breathing, because you should breathe through your nose 99% of the time. And if you cannot breathe through your nose, you have airway issues. And if you don't breathe through your nose at night, you're more likely to have your throat behind your tongue collapse because it creates a negative pressure. So all of these can cause airway, breathing issues, sleep issues. They can be mild all the way to the most severe, which is called obstructive sleep apnea. Now, you may or may not know whether you have sleep apnea. If you've had a sleep test, it can give you an idea of what's going on, or you may realize that you're not getting enough quantity of sleep, or even your quality of sleep is poor. These can all be signs that your airway is compromised, which all go back to an anatomical growth problem of how the jaws grow or grew. Also, there are signs and symptoms that can give us a clue that you might have airway issues or poor breathing patterns. And some of those are grinding. We are not supposed to grind our teeth as humans. We are not supposed to grind a lot. People with TMJ pain, popping, clicking, soreness in the muscles, tension in the neck, cracked teeth, chipped teeth, acid reflux, and again, poor sleep quality. All of these can be indications. If you think that you might have sleep issues, I would highly suggest that you consider getting a sleep study before our consultation, because when we're talking about potential solutions, all of the solutions that we can offer in orthodontics, they're more invasive. However, the great thing is that they can be more solution-oriented and fix the root cause problem. They can actually fix the jaw structure. Whereas other solutions for potential airway issues are going to involve CPAP, which has typically poor compliance, about 50% compliance in the United States, an oral appliance that pulls your jaw and tongue forward out of your airway, which can mess up your bite and further worsen any TMJ issues. You can get a little implant right here that stimulates the nerve to make your tongue come out of your airway at night. That's called Inspire. But what we can offer in orthodontics is something more curative because we change the anatomy of your jaw structure. Now, I'll get into this in a minute, what that looks like, but every person that comes in for a complex consult, they're getting a thorough evaluation on a 3D X-ray to evaluate where the problems are in the jaw structure and how that's impacting your airway specifically, and what signs and symptoms you're experiencing, and then how this parlays into your bite and any damage that you're experiencing on your teeth. So it's a very customized approach, and any treatment options are going to involve some sort of surgical intervention, because if you're an adult, 16 years or older, your jaws are done growing. You cannot change the actual jaw structure. You can move teeth and get bone bending a little bit, but you're limited and it doesn't actually change your true airway volume. So we'll get into that in just a moment. But Please get a sleep study if you think you might have sleep issues, because then you'll be able to really have a better understanding of how severe your sleep issues and airway issues might actually be, so that when we're talking about potential solutions, I can guide you better on what my recommended best case would be for you based on how your symptoms are presenting. So as far as adults go, let's talk about some options. Depending on where the problems are, if you're narrow and both of the jaws are deficient, then it might be that jaw surgery is really the only way to get your jaws back on track. And we do more jaw surgery and orthodontic setups than anybody in Denver. So we're very comfortable with this. And we also have a very streamlined process to make it very doable for you. But it's involved, and we'll want to go over some details of that. But that is truly, as far as sleep apnea goes, it has a, decreasing your sleep apnea numbers. It can decrease it by 50 to 90%. The next best option is if you're narrow and you want some improvement for mild sleep apnea and also maybe a narrow jaw and teeth correction, we can do adult expansion. We call this a MARPE, mini screw assisted rapid palatal expansion. This corrects the width of the upper jaw. It does not bring the jaws forward much. This is done in office. We make a custom printed expander. It's very expensive for us to do it. So you'll see that the cost of these options are higher than traditional orthodontics. But this appliance actually requires screws. I numb the roof of your mouth. I custom design how many screws based on your age, gender, and bone thickness. And then I screw the screws into the palate, and we gently tease open the suture that's been closed since you're about 15, and we widen the actual jaw structure. The benefit of that is you also get better nasal breathing, which means that hopefully at night when you sleep, you're not mouth breathing as much and you're not collapsing as much. But if your airway behind your throat is very, very small, the best option is always going to be jaw surgery to idealize and open up the airway. It's important to understand that a lot of dentists don't understand the in-depth analysis of growth and development. And a lot of orthodontists are very bread and butter orthodontists and also don't look at this whole connection. This makes our practice very special. It requires a lot of attention to detail and many, many, many thousands of hours that I have taken of extra CE course to be able to offer solutions to really complex problems. So the beautiful thing is that you do have solutions, but it's going to be very customized to what your problems are and what your desires are for change. The last option besides a MARPE or jaw surgery is just moving teeth alone. You have to understand how limited this is. If your teeth are experiencing a poor bite, then we can usually improve the bite, but it's going to have very little impact on your airway. We can broaden your arches, but it's just tipping teeth out. And there's a limit to how much you can do that. So if the tongue doesn't have room in your mouth because your jaws are small, we can broaden your arches a few millimeters, but it may not be enough to change sleep apnea. Or as our airway gets worse as we age, it may take the edge off temporarily for a few years, but ultimately your airway will get worse. So it's important to understand that, we may be talking about some of these harder things, but we have solutions that make it very doable. But if you're not willing to undergo orthodontics or a more significant, complex solution for your complex problem, then there's probably not a lot that we can do to help you. But in our practice, we are very accustomed to doing these kind of cases, and we have the experience. I've been practicing for 10 years, and I've been practicing these really complex cases for the last 7. If you want to learn more about this, this is what we'll do at our consultation. We will also send you home with a lot of information to help you digest all of this. If you have questions prior, of course, feel free to reach out, but we're going to cover a lot of this in the consultation. So we can't wait to meet you, and hopefully you are going to get a lot of information and answers from meeting us and coming to our practice. Take care.